Good evening. Here is the news on Koiki Media. First, the headline. 8 years of paralysis. Bedridden woman appeals for public support to access life-changing medical treatment abroad. Now the news and details. I am Tizulakpa Dako. For more than 8 years, Razak Sharifat Folashade has lived with a life-altering medical condition that has left her completely bedridden and dependent on the kindness of others for even the most basic daily activities. Today, she is making an emotional appeal to the general public, charitable organizations, corporate bodies, philanthropists, religious institutions, and government agencies for financial assistance that could give her another chance at life. According to Folashade, our deal began unexpectedly on October 18, 2017. She recalled that the morning started like every other day when a sales assistant arrived at her home to collect the keys to her shop. While checking messages on her mobile phone, she suddenly noticed that her right hand had begun shaking uncontrollably. Initially believing it to be temporary, she was advised to rest and return to bed. However, after several hours, the shaking persisted. Despite feeling unwell, she managed to open her shop before visiting a nearby pharmacy where she was given medication. Unfortunately, the prescribed drugs did not improve her condition. Hoping for a solution elsewhere, she also tried traditional herbal remedies, but her health continued to deteriorate. Within weeks, the condition spread from her right hand to her right leg, before eventually affecting her entire body, including both hands and both legs. Over the years, Folashade says her family exhausted virtually every available option in search of healing. She explained that she had been taken to more than 24 different places, including hospitals, churches, Islamic prayer centers, and traditional healing homes across several states. According to her, every available family resource was spent on medical consultations, transportation, medications, and alternative treatment. Yet, her condition continued to worsen. Today, she says she is completely paralyzed and unable to move any part of her body independently. Folashade's current reality is one of constant physical, emotional, and financial hardship. Since relocating to her late grandmother's house in Ogbomoso in July 2025, she says she has struggled without regular caregivers or close family members nearby. Her father and grandparents have passed away, while her aging mother, now approaching 70 years old, resides in Akure, Ondo State, and is no longer physically strong enough to provide the care she needs. As an only child of her parents, she says most of the responsibility has fallen on the relatives who have already spent years trying to secure treatment for her. Because she cannot move, she depends entirely on paid caregivers to assist her bathing, changing clothes, feeding, cleaning, and helping with personal hygiene. According to her, there are periods when she goes several weeks without anyone available to assist her, because she cannot always afford to pay for caregiving services. She added that an elderly woman living nearby occasionally helps when she returns from her shop in the evening, despite her own advancing age and limited strength. Despite years of suffering, Folashade remains hopeful. She said medical evaluations, including MRI scans and other investigations conducted in 2020 and 2021, reportedly indicated that her condition involves severe spinal cord damage that requires highly specialized treatment. According to her, doctors advise that she may require advanced medical care in countries such as India, China, Egypt, or France, where specialist treatment and rehabilitation services are available. Although the cost of such treatment is far beyond her family's financial capacity, she says she believes recovery is still possible if she can access the necessary medical intervention. With no stable source of income and her family having exhausted their resources over the years, Falashade is appealing to compassionate Nigerians, charitable foundations, humanitarian organizations, religious bodies, corporate organizations, and government agencies to support her financially. She says every contribution, regardless of the amount, could bring her one step closer to receiving the specialist treatment she urgently needs. The appeal comes after more than 8 years of living with paralysis, during which she has remained confined to bed while waiting for an opportunity to receive life-changing medical care. Anyone willing to support her is encouraged to